This is a Blend Extra. Well, some women this summer wore long pants instead of skirts and dresses, but it's not because of the cooler than normal temperatures. They're hiding their veins. Dr. Deborah Manjoney is the director of the Wisconsin Vein Center MediSpa and is here to tell us more about varicose veins and what to expect from the treatment process. Thanks for being here, Doctor.
Thank you. It is true. So many women do hide their legs during the summer, and it's a shame.
I know.
Because this is the time of year they want to be bearing a little bit more skin and wearing those skirts and dresses, and their varicose veins prevent them from doing that.
So let's talk about why someone needs to take care of their varicose veins, what the problems are, and why they would come to you to do something.
Well, varicose veins are draining your legs, and so they're carrying blood back to your heart and lungs after the oxygen's been removed, and so those veins are part of the circulation system. And if they're not working properly, that can lead to swelling of the legs, and it can lead to symptoms of cramping at night, aching during the day, fatigue by the end of the day, and those symptoms can be really very annoying and can disrupt their normal life practices.
This is a pretty unattractive picture.
Yes,
all of these are, but these are very real pictures of patients that you've worked with.
That's right.
And that you've taken care of the veins, and this is the real result.
Right, and the wonderful thing is we can do all this in the office using what we call minimally invasive techniques. So we're using local anesthesia only, just injecting anesthetic, and using tiny little needle punctures to take care of any of these processes. It might include threading a little laser up inside a vein, or it might just involve removing some of the big bulges through little tiny needle punctures.
I feel like in the summer I have issues even just because of the humidity with joints and some pain there. Does that also make your legs feel worse sometimes?
It really does. The heat of the summer, and especially adding in that humidity, makes the veins get actually a little bit more swollen, so they're not even functioning as well as they would. And when that happens, the legs can get more swollen, and people really have a lot more symptoms during that hot weather.
How about insurance? Because I can imagine a lot of people don't come in, A, because they don't want to know what they have to do, but B, they're afraid of the cost.
Right, and insurance does cover most people who have symptomatic varicose vein disease, which is a wonderful thing to know. But the important thing is to know that this time of year probably is the time you better start thinking about getting it done if you want to finish the treatment process this year.
Okay.
Because most insurance companies do require a trial period of graduated compression hose before we can even request treatment to be authorized. And so right now is the time, because it may be 6 weeks or 3 months of a required compression hose, and if people are paying off their deductibles, they've had other medical problems during the year, or their families have had medical issues that have cost some money out of pocket, now is the time to get in so you can have this taken care of before your deductible has to start again in January.
And it's never too soon, right? I had spider veins, which were more cosmetic, but I found out after I got rid of them that I had less achiness and sore and heavy legs.
I think we see that a lot, that people do have spider veins that can cause symptoms.
Yeah.
You know, more localized symptoms rather than a generalized aching, but they can really be nuisances to have. So it's not just their appearance, they actually can throb, or they can make your leg have an ache in that area. And by getting those taken care of, it really does get rid of the symptoms.
Yeah, mine were very tired, you know, and I always thought, oh, I'm just walking too much, or I'm doing something, you know, too much, but they feel completely different after having that done.
Normally your legs shouldn't feel tired after a regular day of activity.
Yeah, I think the key here is to see a professional like yourself, whether you have sore, achy, heavy legs, you have cramps, if it's just looking cosmetic, to make sure that there's not an underlying problem. You can visit the Wisconsin Vein Center and MediSpa on Georgetown Drive in Pewaukee. Call the number on your screen, 262-746-9088, or WIMedispa.com. Thanks so much, Doctor.
Thank you, Tiffany.